Oh, so we are live and मुझे पता नहीं चला कि हम लाइव चले गए. So sorry, I am bit late because right now क्लास चल रही थी प्लस कोर्स पर and the topic of the class was androgenic drugs and the drugs for or the treatment of इरेक्टाइल डिसफंक्शन. सो ये क्लास चल रही थी 8 से 9 का टाइम था बट थोड़ा सा लंबा खिंच गई. सो दैट्स वाई आई एम अ बिट लेट. सो sorry and who let's get started, guys. Let's get started. What's up? Welcome back. So I am Shiv Virmani and Indian medical student and author of the book Pharmac Easy, and welcome to the top online learning platform, that is Unacademy. And this you all know that how you can download or install the app. You can just write Unacademy on App Store or Play Store, and from there you can install it for free. And ये install करने के बाद आप easily free special classes देख सकते हो, right? And you can ask your queries and all of that. And if we talk about the subscription, then there are two choices, plus and iconic. So if you are a second or a third year medical student, then I would rather refer you iconic course. But if you want to check or if you want to just get benefit of Unacademy, then you can use plus course. You can buy plus course, and if you buy plus course, then you get the access to live classes. You get access to take tests, quizzes, batch courses. You can enroll yourself into batch courses, and you get the structured schedule, right? You get the structured schedule, and that is the main thing you need to crack any of the exam. And iconic course, you get all the benefit of Unacademy, but with the benefit of Unacademy you get the benefit of prep ladder as well. You get the access of the free pre-recorded video lecture, then Q Bank 2.0 rapid revision course, and handwritten notes. So yeah, right. And if you want to buy the subscription of the iconic course, then you have 12 months plan, 18 months plan, 24 months plan, and 36 months plan. And if you want to buy, then you can use the code Virmani and you will be getting 10% off, right? Right. And if you want to buy the plus course, then you have many choices. You can buy it for 1 month, 3 months, 6 months, 12 months, 18 months, 24 months, and 36 months. And yeah, if you want to buy this, then also you can use the code Virmani and you will be getting 10% instant off. So what is this? Why are we studying the drugs affecting class? We have already completed this thing. So here in this session we are supposed to do the adrenergic drugs, or the drugs that will stimulate the sympathetic system. So since today we have started with the cholinergic system or ANS, so we have discussed, or I have told you, that there are two ANS types, or there are two systems. First is parasympathetic, and other is sympathetic. So ANS is having two subdivision, parasympathetic and sympathetic. Parasympathetic is activated when you are at resting position. Resting position. Right. Sympathetic activates when you are frightened, you have to fight, और you have to flight, right, भागना है या लड़ना है, then your sympathetic activation will take place, right? And the drugs that will be increasing the sympathetic stimulation, that are adrenergic drugs, and today we will be talking about these drugs only, right? And parasympathetic में we were studying about the cholinergic, and we will be trying to complete the adrenergic drugs, but let's see, because सुबह से काफ़ी सारी सेशंस हो चुके हैं and I am a bit tired, so जब तक गला अलाउ करेगा, थ्रोट अलाउ करेगा, तब तक I will take, and जब थोड़ा सा हुआ then we will take a break and we will meet tomorrow. So there was a 2 p.m. wala session today in which we have studied the cholinergic system. Then we were having a 5 p.m. wala session in which we have studied the anticholinergic system. Then here now 9 p.m. wala session mein we will be having adrenergic system. So guys, cholinergic system means when there is a parasympathetic stimulation, right? And there are actions like increased secretions, meiosis, bronchospasm, bradycardia, and all of that. Then anticholinergics were opposite to this thing. They were opposite to parasympathetic because they were blocking the parasympathetic system. So they were doing mydriasis, they were decreasing the secretions, they were causing the dry mouth, they were causing the urinary retention, they were causing a bronchodilation that we use to treat the patient with the acute attack of asthma and COPD. So anticholinergics are the drugs that decrease the secretions, that cause dry mouth, that cause urinary retention, that are not or basically they are used to decrease the gastric acid as well. Then they are used to dilate the bronchus in the asthmatics and COPD patients. After that, there is a combination called as duolin. That is having a combination of I should write here, ipratropium bromide. Second thing which a duolin consists is salbutamol. So ipratropium bromide is a M3 blocker or antagonist. Salbutamol is a beta 2 agonist, right? So this is a combination जिसका नाम है duolin, and that is readily used for asthmatics, acute attack of asthma, and duolin, right? So now let's start the adrenergic system. So as discussed earlier, cholinergic system के बेस पर what is the neurotransmitter. So which neurotransmitter causes a cholinergic transmission? Acetylcholine, right? So acetylcholine is there which causes a cholinergic transmission, right? And it is the only transmitter that stimulates parasympatheticity, right? That stimulates the parasympathetic actions, that promotes the parasympathetic actions. As such, adrenergic transmission तीन चीजों की वजह से होता है, and basically they are called as catecholamines. So adrenergic transmission is because of the production of the endogenous catecholamines, that is a noradrenaline, adrenaline and dopamine. So noradrenaline, it acts at transmitter that acts at post-ganglionic sympathetic sites and except the sweat glands, hair follicle and some vasodilator fibers, and in certain areas of brain as well. Adrenaline is secreted by adrenal medulla and may have transmitter role in the brain. Then dopamine is a major transmitter in the basal ganglia, limbic system, CTZ, anterior pituitary, etc. and in the limited manner in the periphery. So adrenergic transmission is restricted to the sympathetic division of the ANS, right? So adrenergic transmission is due to the three endogenous catecholamines, that are noradrenaline, adrenaline and dopamine. So noradrenaline, it acts as a transmitter at post-ganglionic sympathetic sites except the sweat glands, hair follicle and some vasodilator fibers, right? Wait a second, let me just see what's going on in the live chat. Yeah, it's fine, Anna. Yeah. Wait a few more seconds, guys. What's wrong with you, man? Yeah, this we have discussed that the main transmitter or the three main catecholamines जिसकी वजह से there is the adrenergic transmission, that are three noradrenaline, adrenaline and dopamine, right? Then synthesis कैसे होता है? How these catecholamines are synthesized in our body? How? So catecholamines are synthesized from the amino acid phenylalanine. Phenylalanine, right? Tyrosine hydroxylase is a specific and a rate limiting enzyme. Its inhibition by alpha methyl P tyrosine results in depletion of catecholamines. So guys, catecholamines are synthesized from the amino acid phenylalanine, right? Then there is an enzyme tyrosine hydroxylase, that is a specific and rate limiting enzyme, and its inhibition by alpha methyl P tyrosine results in the depletion of catecholamines, right? And all other enzymes of CA synthesis or catecholamine synthesis are rather non-specific and can act on closely related substances. Example, dopa decarboxylase that can form 5-HT from 5-hydroxytryptophan and alpha methyl DA from alpha methyl dopa. So guys, all other enzymes of the catecholamine synthesis are rather non-specific and can act on closely related substrates. Example, dopa decarboxylase, that can form 5-HT from 5-hydroxytryptophan, and alpha-methyl DA from alpha-methyl dopa. So synthesis of Na occurs in all the adrenergic neurons, while that of adrenaline occurs only in the adrenal medullary cells, and it requires a high concentration of glucocorticoids reaching through the intra-adrenal portal circulation for induction of the methylating enzyme. So catecholamines are synthesis from the amino acid phenylalanine, and tyrosine hydroxylase is a specific and a rate limiting enzyme. This is the most important thing that you should be remembering for your MCQs. Its inhibition by alpha-methyl P-tyrosine results in the depletion of the catecholamines, and this inhibitor can also be used in the pheochromocytoma before surgery and is inoperable cases. All other enzymes of catecholamine synthesis are rather non-specific and can act on closely related substrates. Example, dopa decarboxylase, and can form 5-HT from 5-hydroxytryptophan and alpha-methyl DA from alpha-methyl dopa. Synthesis of Na occurs in all the adrenergic neurons, while that of adrenaline occurs only in the adrenal medullary cells, and it requires high concentration of glucocorticoid reaching through the intra-adrenal portal circulation for induction of the methylating enzyme. Right, so this is the main mechanism. Phenylalanine is the first step, and there is tyrosine decarboxylase. There is tyrosine hydroxylase. So phenylalanine is converted to the tyrosine. Tyrosine is further converted to the dopa. In the adrenergic neuronal cytoplasm, dopa gets converted to the dopamine, and inside vesicles, dopamine gets converted to the noradrenaline. Noradrenaline gets converted to the adrenaline, but adrenaline is only formed into the adrenal medulla. Noradrenaline acts in all over the body. Right. Storage of catecholamines. So noradrenaline is stored in the synaptic vesicle or granules within the adrenergic nerve terminal. Right. So noradrenaline is stored in the synaptic vesicle or granules within the adrenergic nerve terminal, and the vesicular membrane actively takes up the dopamine from the cytoplasm, and the final step of the synthesis of the Na takes place inside the vesicle, which contain the dopamine beta hydroxylase. So guys, Na is stored in the synaptic vesicle and or the granules within the adrenergic nerve terminal, right? Then the vesicular membrane actively takes up the dopamine from the cytoplasm, and the final step of the synthesis of Na takes place inside the vesicle, in which contains the dopamine beta hydroxylase. So dopamine आता है वेसिकल के अंदर, and with dopamine beta hydroxylase, and ये convert कर देता है इसको noradrenaline में. And noradrenaline is then stored as a complex with ATP in a ratio of 4:1, which is absorbed on a protein chromogranin granule. And in the adrenal medulla, the noradrenaline thus formed within the chromaffin granules diffuses into the cytoplasm and is methylated, and adrenaline is formed, and that is taken up by the separate set of granules. So Na is stored in the synaptic vesicles or the granules within the adrenergic nerve terminal, and the vesicular membrane actively takes up the dopamine from the cytoplasm, right? And the final step, there is the synthesis of Na, and basically क्या होता है कि dopamine है, dopamine comes, dopamine enters to the vesicle with dopamine beta hydroxylase. And what is happening here? Dopamine will be reacting with the dopamine beta hydroxylase, and it will be getting converted to the Na. And in all of the body, dopamine will be converted to the Na, and Na अपना काम show करेगा. But specifically in adrenal medulla, that dopamine that is converted to noradrenaline. So with the help of, basically they attach to the chromaffin granules and they diffuses out to the cytoplasm and वहाँ पर उनका methylation होता है. So the noradrenaline in the adrenal medulla is methylated in the cytoplasm to form adrenaline, and this adrenaline is only formed in the adrenal medulla, right? Where is the pen? Here, yeah. The cytoplasmic pool of CAs is kept low by the enzyme monoamine oxidase present on the outer surface of the mitochondria. So this is the metabolizing enzyme. Let me say that here Na is formed, Na exocytose हो गया, बाहर आ गया. Then we are having this monoamine oxidase that will be metabolizing this Na and degrading it, right? So initial, if there were 100 molecules of Na, now after encountering with monoamine oxidase, they will be converted to 20, right? Then release of the Ca or catecholamines. The release impulses coupled release of the catecholamine takes place by exocytosis. So it is impulse mediated. So whenever a stimulus impulse comes, then only catecholamines का release takes place by exocytosis, right? And क्या क्या बाहर आता है by exocytosis? All the vesicular contents. So vesicle के अंदर जो जो content होता है that comes out. First is noradrenaline, second is adrenaline, ATP, dopamine beta hydroxylase, जैसे हमने डिस्कस करा था कि a vesicle के a dopamine enters into the vesicle with dopamine beta hydroxylase and it gets converted to the noradrenaline, and this noradrenaline chromaffin granules के साथ attach होकर it will be entering to the cytoplasm, it will be coming out into the adrenal medulla cytoplasm and it will be converting to the adrenaline and it will be again going toward the synaptic vesicle. So this thing only happens into the adrenal medulla, and till here it happens in our full body. So exception is there in adrenal medulla, right? So dopamine is there, dopamine enters the vesicle with the dopa beta hydroxylase and it will be converting it to the noradrenaline. Then how it will come out? So noradrenaline will be or exocytosis will be taking place, and exocytosis की वजह से there will be exit of noradrenaline, right, from the synaptic terminal. So क्या क्या बाहर आता है? First of all noradrenaline, that is the neurotransmitter, and in adrenal medulla adrenaline comes out with ATP, with dopamine beta hydroxylase, with chromogranin granules, right? These things are poured out. In case of vesicles, which in addition contain peptides like enkephalin, neuropeptide Y, these co-transmitters are simultaneously released, and the release is modulated by presynaptic receptors, of which alpha 2 inhibitory control is dominant, right? So the release is modulated by the presynaptic receptors. Basically what is happening here is, this is the synaptic terminal, यहाँ से बाहर है ना, so presynaptically they are having alpha 2 receptors, वहाँ से reuptake वापस हो जाएगा, right? So they will be decreasing the amounts here, active amounts decrease हो जाएगी, right? Then indirectly acting sympathomimetic amines like tyramines etc. also induce the release of Na. but they do so by displacing Na from the nerve ending binding sites and by exchange diffusion. Utilizing the norepinephrine transporter, the carrier uptake one. This process is not exocytotic and does not require calcium. So, what it is saying is that there is a indirectly acting sympathomimetic amines, that is a tyramine and a amphetamine. Right. So there are two types of the indirect acting amines. One is tyramine, second is amphetamine. Right. So let me just draw a synaptic terminal and उससे हमें अच्छे से समझ में आ जाएगा. So this is a synaptic terminal, right? This is a vesicle जिसके अंदर Na है, right? Outside we are having tyramine, and tyramine कहाँ से मिला? By having cheese, right? चीज लेने से टायरामीन मिला. टायरामीन इज इनडायरेक्टली एक्टिंग सिंपैथोमाइमेटिक. हाउ? व्हाट इज हैपनिंग हियर? Na और टायरामीन ये दोनों दुश्मन है, राइट? व्हाट इज हैपनिंग हियर? टायरामीन इसके पास आएगा, टायरामीन इसको बोलेगा गेट out, this is my house, get out, right? So tyramine इसको बाहर निकाल देगा और Na बाहर आ जाएगा, right? Na बाहर आ गया, टायरामीन अंदर चला गया वेसिकल के अंदर, right? टायरामीन अंदर चला गया, Na बाहर आ गया, और Na बाहर आने के बाद एक्टिव है. So that's why indirectly act कर रहा है ये. It is indirectly increasing the release of Na. So tyramine and amphetamine is indirectly increasing the release of Na. इसको एक बड़ा डायग्राम बनाता हूं और फिर समझते हैं. This is a synaptic terminal. This is a synaptic vesicle. Na पड़ा हुआ है. पेशेंट ने खाया चीज, चीज से मिला टायरामीन, टायरामीन आया, टायरामीन Na के पास आया, टायरामीन ने Na को बोला कि दिस इज माई हाउस. और Na बहुत ही ज्यादा ना शरीफ है टायरामीन के सामने. टायरामीन इज सेइंग दैट दिस वेसिकल इज माय हाउस, यू बेटर गेट लॉस्ट, राइट? सो टायरामीन विल बी ऑक्यूपाइंग द स्पेस इन दिस वेसिकल, एंड ये Na को बाहर निकाल देगा. Na बाहर आ जाएगा, right? Na will come out, right? In active form. टायरामीन इसको डिस्प्लेस कर देगा, टायरामीन इसकी जगह पर चला जाएगा, Na एक्टिवली बाहर आ जाएगा, राइट? एंड एक्टिव Na आप सबको पता है क्या करेगा? sympathetic activation, right? Sympathetic activation. Right? Yeah. So in case of vesicles, which in addition contain the peptides like enkephalin, neuropeptide Y, और ये सब तो हमने कर लिया था, एंड हमने ये भी कर लिया. So Na आएगा बाहर, सिंपैथेटिक एक्टिवेशन करेगा, एंड Yeah, it will be increasing the Na, and this is mediated by NET, right? ये exchange is mediated by NET. Now comes the uptake of catecholamines. There are three types, but important are of two types, right? First is axonal uptake. It is an active amino uptake or active amine pump. NET is present at the neuronal membrane, which transports noradrenaline by a Na plus coupled mechanism, right? It takes up Na at a higher rate than adrenaline and had been labeled uptake 1. The indirectly acting sympathomimetic amines like tyramine but not isoprenaline also utilize this pump for entering the neuron. So yeah, we have discussed it right now that tyramine or amphetamine will be using this type of NET transporter for their exchange, for the displacement, right? So axonal uptake is having an active amino pump, that is NET, that is present on the neuronal membrane, which transports the noradrenaline by a Na coupled or sodium coupled mechanism. It takes up Na at a higher rate than adrenaline and had been labeled uptake 1. The indirectly acting sympathoamines like tyramine, amphetamine also utilize this pump for entering the neuron. This uptake is the most important mechanism for terminating the post-junctional action of Na. From 75% to 90% of the released Na is retaken back into the neuron, and this pump is inhibited by cocaine, desipramine and other few drugs. This is the important thing, that this pump is inhibited by cocaine, desipramine. NET can be inhibited by cocaine, desipramine, right? I hope it's fine, everything is going good, right? Then second type of uptake, vesicular uptake. So the membrane of intracellular vesicle has another amine pump, the vesicular monoamine transporter or VMAT2. So first transporter was consisting of NET, right? And the second, that is vesicular uptake, is having vesicular monoamine transporter or VMAT2. So this transports the catecholamine from the cytoplasm to the interior of the storage vesicle, right? So पहले वाला हमारा क्या कहाँ था, यहाँ पर था NET, but this is present on the vesicle. VMAT2 is present on the vesicle. That is letting the exchange of the neurotransmitter from the cytoplasm to the vesicle or from vesicle to the cytoplasm. So the membrane of the intracellular vesicle has another amine pump, that is VMAT2, which transports the catecholamine from cytoplasm to the interior of the vesicle, right? It is not like NET. Locations are different. That's why names are different, and as the name suggests, axonal uptake is on the nerve terminal, right? And vesicular uptake is on the vesicle, right? The VM82 transporter monoamines. VM82 transports the monoamine by exchanging with H plus ions, and the vesicular Na is constantly leaking out into the exoplasm and is recaptured by this mechanism. So what is happening here, न्यूरोट्रांसमीटर ना कई बार ऐसे लीक हो जाता है बाहर और वो यहाँ से recapture हो जाता है, right? So that is the main mechanism. This carrier also takes up dopamine formed in the exoplasm for further synthesis of Na. Thus, it is very important for maintaining the Na content of the neuron, and this uptake is inhibited by reserpine, resulting into the depletion of catecholamines. Axonal was inhibited by cocaine. Vesicular is inhibited by reserpine. Let's see third type of uptake में क्या हो रहा है. So the third type of uptake is called as extraneuronal uptake of catecholamine, and it is carried out by the extraneuronal amine transmitter or ENT or OCT3 and other cation transporters, that is OCT1 and OCT2, into the cells of the other tissues. And in contrast to NET, this uptake transports the adrenaline at higher rate, but axonal was taking Na at higher rate, but this is taking adrenaline at higher rate. It is not a sodium dependent transporter like axonal. Thus, it is not inhibited by cocaine, but it is inhibited by corticosteroid. Right? So, axonal wala was inhibited by cocaine, vesicular was inhibited by reserpine, extraneuronal is inhibited by corticosteroid, and it may capture circulating adrenaline, but is quantitatively minor and not of physiological or pharmacological importance. So it may capture the circulating adrenaline, but it is quantitative, minor, and not of physiological or pharmacological importance. Right? So like मैंने आपको पहले बताया था कि only two types are important. So दो जो important है, that is axonal and vesicular. Right? And now let's move further. लाइव चैट हैंग हो गई यार गाइस. व्हाट इज हैपनिंग, व्हाट इज हैपनिंग, व्हाट इज हैपनिंग. Wait a few seconds, let me just check what's wrong with the live chat. लाइव चैट बंद करके देखते हैं. Let's just close this once and then we'll see what is what's wrong with the live chat. Hey live chat, wait a second, wait few more seconds guys, wait few more seconds. I don't know what's wrong with this thing. Yeah, I think now it's fine. एक्चुअली दिक्कत क्या आ जाती है कि लाइव चैट दिखना ही बंद हो जाती है, पता नहीं क्या प्रॉब्लम है. अब इट इज़ फाइन अगेन एंड नाउ लेट्स स्टार्ट. Network is fine, everything is fine, battery is okay. Then also let's just jump towards our topic. So tyrosine comes here. So primary step is phenylalanine, then it is converted to tyrosine. Tyrosine is converted to dopa. Dopa converts to dopamine. Dopamine comes or enters the VMAT2. So it enters to the vesicle through the vesicle transport or VMAT2 transporter, right? And this dopamine is converted to Na. Na बाहर जाएगा एक्सोसाइटोसिस से. अब यहां पर एक्सोनल रीअपटेक हो सकता है, राइट, NET के थ्रू. NET के थ्रू. So NET, if there are 100 molecules जो बाहर गए हैं, it will be reuptaking 40 molecules, right, और बाकी कुछ मेटाबोलाइज हो जाएंगे. So yeah, it will be decreasing the active Na, right. So tyrosine is there, it will be converting to dopamine. Dopamine will be going to the vesicle, entering the vesicle, and it will be converted to Na. Na का एक्सोसाइटोसिस होगा. Na फिर बाहर रिसेप्टर्स पर एक्ट भी करेगा. सो कहाँ एक्ट करेगा? एड्रीनो रिसेप्टर्स पर. एड्रीनो रिसेप्टर्स आर ऑफ 2 टाइप्स, अल्फा एंड बीटा. फर्दर अल्फा के कुछ सब टाइप्स हैं, बीटा के कुछ सब टाइप्स हैं, उसके बारे में हम बाद में डिस्कस करेंगे, राइट. पहले ये मैकेनिज्म बहुत समझना ज़रूरी है. सो टायरोसिन, डोपा, डोपामिन से नॉरेड्रेनालिन, एड्रेनालिन से एक्सोसाइटोसिस. सो गाइज, this Na will be metabolized by COMT and monoamine oxidase. So these are the 2 metabolizing enzymes जो इसको मेटाबोलाइज कर देंगे, राइट. और एक और चीज़ है मेरे को याद आ गई. हाँ, एक तो ये अल्फा 2 जो है, सो अल्फा के 2 होते हैं, अल्फा 1 एंड अल्फा 2. अल्फा 2 आर प्री जंक्शनली एंड अल्फा 1 आर पोस्ट जंक्शनली. तो प्री जंक्शनली मतलब दीज आर ब्रेक्स मतलब दे विल बी एक्टिंग लाइक NET reuptake. So they will be also reuptaking the amount of Na, right. And then this thing I want to discuss, indirectly transport or indirectly exchange of tyramine from Na. So tyramine एंटर हुआ और इसने कहा कि भाई ये मेरी जगह है, बाहर चला जा. नॉरेड्रेनालिन बाहर आ जाएगा, टायरामीन उसकी जगह ले लेगा, राइट. सो tyramine can cause cheese reaction if patient is taking MAO inhibitors. ये चीज़ समझना बहुत ज़रूरी है, और ये चीज़ अब समझते हैं बैठ के कि देखो, the patients who are taking antidepressants, right, or any drug that can inhibit monoamine oxidase, right. So in the simplest language, if patient is taking monoamine oxidase inhibitors, then what will happen? Monoamine is the enzyme that will be metabolizing the adrenaline or noradrenaline to inactive compounds. Right? इतना समझ में आया ना? So monoamine oxidase inhibitors अगर लिए, सो ये जो इनएक्टिव में हो रहा था ये नहीं होगा कन्वर्ट सबसे पहले तो. देन बाकी तो देखो COMT भी है, देन रीअपटेक भी हो जाएगा, तो नॉर्मल रहेगी चीजें. बट इफ दिस पेशेंट इज गोइंग टू अ पार्टी एंड ही इज हैविंग फुल पिज्जा. पिज्जा के अंदर है चीज के अंदर है टायरामिन, So this tyramine will be displacing the resting noradrenaline एंड टायरामीन कहेगा कि तू घर से बाहर निकल, ये मेरा घर है. नॉर एड्रेनलिन के घर से बाहर निकाल देगा. नॉर एड्रेनलिन बाहर आके एक्शन शो करेगा और नॉर एड्रेनलिन का एक्शन क्या होगा? हाइपरटेंशन क्राइसिस. सो इतना ज्यादा बीपी शूट हो जाएगा, दैट इज कॉल्ड एज हाइपरटेंसिव क्राइसिस एंड दैट इज ऑल्सो कॉल्ड एज चीज रिएक्शन. राइट. एंड चीज रिएक्शन की अगर मैं बात करूं तो द ड्रग दैट इज यूजफुल टू ट्रीट द चीज रिएक्शन इज फेंटोलामीन. फेंटोलामीन is the drug that should be given if you want to, or basically if you want to treat this thing, right? And there are conditions like clonidine withdrawal, cheese reaction. In these both conditions there is a hypertensive crisis. और इस हाइपरटेंसिव क्राइसिस को ट्रीट करेंगे हम फेंटोलामीन से. दैट इज रिवर्सिबल, दैट एक्ट्स रिवर्सिबली, राइट, ऑन अल्फा, राइट, एंड दैट विल बी डिक्रीजिंग द बीपी, राइट, इट विल बी ब्लॉकिंग, राइट. सो नाउ लेट्स मूव फर्दर. सो गाइस, adrenergic receptors, they are of two types. And further they are of two types. Alpha is of two types, alpha 1 and alpha 2. alpha 2 को आगे बहुत ज़्यादा ब्रेक करा गया है, बट हम उतना डीप में नहीं जाएंगे. बीटा को भी ब्रेक करा गया है, बीटा 1, बीटा 2 एंड बीटा 3. बीटा 3 के बारे में सिर्फ आपको इतना पता होना चाहिए कि दिस इज यूज्ड, बीटा 3 इज यूज्ड for the treatment of obesity, right. Then हम आगे बढ़ते हैं. तो adrenergic receptors are the membrane bound G protein coupled receptors which function primarily by increasing or decreasing the intracellular production of the second messengers SCAMP and IP3DAG, and in some cases the activated G protein itself operates K plus calcium channels or increases the prostaglandin production. And they are of two types, alpha and beta. So alpha का काम देखो, alpha acts on adrenaline. So rank order of potency of agonist, adrenaline is maximum and isoprenaline is minimum. And on beta, isoprenaline is maximum, right. Isoprenaline stimulates beta 1, beta 2 and beta 3, all the three, but as such adrenaline नहीं करता. Then antagonist, phenoxybenzamine, phentolamine, right. Phenoxybenzamine is irreversible blocker or irreversible antagonist of the alpha receptors, and as it is irreversible, so it is not used normally. It is only used in the tumor like conditions of pheochromocytoma. So alpha blocker, that is irreversible blocker, and the drug is phenoxybenzamine, is only useful in pheochromocytoma. Then we are having a reversible blocker, that is phentolamine. So phentolamine is the drug that is reversible blocker, right. इसके अंदर और phenoxybenzamine में डिफरेंस है सिर्फ रिवर्सिबल और इरिवर्सिबल का. phenoxybenzamine is irreversible, but phentolamine is reversible, and phentolamine is having its use for the treatment of the hypertensive crisis in the clonidine withdrawal reactions and cheese reaction. Then the coupling protein जिस पर ये जाके act करते हैं is GQ-GIGO. Effector pathway is by activating the IP3DAG, by inhibiting the CAMP and by activating the K plus channels. Then beta blocker propranolol, this is the prototype, आपको सबको पता है जिस ड्रग के पीछे ओलॉल रख जाए that is a beta blocker, right? Coupling protein is GS, and if you are not understanding this GQ, GI, GO, GS, so आपको देखना पड़ेगा इंट्रोडक्शन वाला सेशन, मतलब आपको देखना पड़ेगा जनरल फार्माकोलॉजी का फार्मेको काइनेटिक्स वाला सेशन, राइट, उसी के अंदर ये है. तो अगर समझ में नहीं आ रहा तो वो देख लो, जी प्रोटीन कपल्ड रिसेप्टर देख लो एंड फिर आ जाओ, राइट. एंड इट विल बी इंक्रीजिंग द कैम्प एंड इट विल बी इंक्रीजिंग द कैल्शियम चैनल, राइट. Then difference between the beta 1, beta 2 and beta 3, right? Beta 3 में आपको सिर्फ एक ही चीज याद रखनी है, वो अभी बताऊंगा मैं. So beta 1 जो है that is present on the heart. देखो हार्ट आपके पास एक ही है, दो तो नहीं है ना, एक ही है. So beta 1 and heart is also 1, so beta 1 is on heart. Plus beta 1 is present on JG cells in the kidney as well, and this stimulates the renin release. So if you want to decrease the renin, जैसे कि हमने RAS inhibitors में बात करी थी, if you want to inhibit the renin release, so you can give beta 1 blocker or beta blockers, and thus they are regarded as renin release inhibitors. They are not direct renin inhibitors. Direct renin inhibitor is a Ellis-Kirin, right? So both are different things. Renin release inhibitor is a different thing. Direct renin inhibitor is also a different thing. Selective agonist की अगर मैं बात करूं, then dobutamine is the selective agonist. Dobutamine, dopamine, isoprenaline, adrenaline, noradrenaline. Then amphetamine is also the selective agonist. मतलब selective नहीं, but they are agonist. Selective antagonist की अगर मैं बात करूं, then metoprolol and atenolol, because they are cardioselective. And अगर आप अब मेरे को ये कहो कि प्रोपेनोलॉल क्यों नहीं है, प्रोपेनोलॉल इज अ प्रोटोटाइप, यहां क्यों नहीं, बिकॉज वी आर टॉकिंग अबाउट सिलेक्टिव एंटागोनिस्ट. प्रोपेनोलॉल blocks both beta 1 and beta 2 both, but here we are only talking about cardioselective beta blockers, right? And then relative potency of noradrenaline and adrenaline. So beta 1 is more potent with the adrenaline. Then comes the beta 2. Lungs आपके पास दो होते हैं, so beta 2 is present on lungs plus smooth muscles में, blood vessels, GIT, uterus, urinary tract, eye and liver as well. And beta 2 agonist is a salbutamol and terbutaline. Isosuprin भी है और राइटोड्रिन भी है. These are selective agonists. Salbutamol is the drug of choice for the acute asthma attack, right? And it is combined with the ipratropium bromide, and the combination is called as duolin, right? And the selective antagonist is propranolol, and it is also having a relative higher potency with adrenaline. Beta 3, they are only present on the adipose tissue, and this is what you should be remembering. Alpha 1, as I have earlier told you, that alpha 1 are present post junctionally, but alpha 2 are present pre junctionally, right? So alpha 2 are kind of breaks, right? So alpha 1 they act post junctionally on the effector organs, and functional subserd की अगर मैं बात करूं, then they cause GU smooth muscle contraction, vasoconstriction. अब यही आप कहोगे कि ब्लड वेसल्स पर कौन कौन एक्ट करता है. ब्लड वेसल पर दो चीजें एक्ट करती हैं जिनका ज्यादा इफेक्ट आता है. वन इज अल्फा 1 एंड अदर इज बीटा 2. अल्फा 1 causes vasoconstriction, beta 2 causes vasodilation. As 1 comes first in numerals, same goes with alphabets. C comes first in the alphabets. So alpha 1 will be causing constriction, C, constriction. 2 comes later. Same D, same goes with D. So beta 2 causes dilation, right? Alpha 1 are stronger. Beta 2 are sensitive. Alpha 1 स्ट्रॉन्ग है, बीटा 2 सेंसिटिव है. ये दोनों चीजें आगे मैं समझाऊंगा जब हम पढ़ेंगे वेजोमोटर रिवर्सल ऑफ डेल एंड वेजोमोटर रिवर्सल ऑफ डेल, राइट. देन alpha 1 increases the secretions, it relaxes the gut, it causes glycogenolysis on liver as well, and on heart it can cause arrhythmia. And selective agonist is phenylephrine methoxamine. Agonist, we are talking about agonist. And selective antagonist is prazosin. Prazosin is really effective drug if you want to give it as a hypertensive and benign prostatic hypertrophy. If a old 60-year-old male patient is having both, he is having hypertension with BPH, then you will be referring this drug, prazosin, right? And the coupling protein, it acts through GQ. And the effector pathway, ये कैसे act करता है? Through increasing the IP3-DAG and increasing the phospholipase A2 and PG release, right? Then alpha 2, that are the brakes. So they are pre-junctional on the nerve ending, right? And also the post-junctional in the brain. So mainly they are pre-junctional, right? And pre-junctional का ही main effect आता है, right? Pancreatic beta cells, extrajunctional in central blood vessels, platelets and all of that यहाँ पर होता है, but इतना as such it does not produce any functions. Then functions that it does is inhibition of the transmitter release. Inhibition means reuptake of the transmitter release. It tries to reuptake the transmitter that is immediately released, right? So it will be decreasing the amount of neurotransmitter. Then it causes vasoconstriction, same as alpha 1. But most importantly, most potently, vasoconstriction is caused by alpha 1. Then decreased central sympathetic flow it causes, and then it also causes decreased insulin release because it is also present in the pancreatic beta cells, right? Then it can cause platelet aggregation as well. And selective agonist is clonidine, and selective antagonist is yohimbine, right? और यही आपको याद रखना है. बट योहिम्बिन का कहीं भी कोई भी यूज नहीं है. And it acts through coupling protein GI and GO and effector pathway जिससे ये act करता है. It also increases the IP3 DAG, but it decreases the CAMP, it increases the K plus channel, and it can increase or decrease the calcium channels. Right. So now comes the adrenergic drugs or sympathomimetics, right? Now comes the sympathomimetics. These are the drugs with action similar to that of the adrenaline or of the sympathetic stimulation. So they will be increasing the adrenaline or noradrenaline, right? They can act through direct sympathomimetics, they can act through indirectly, and they can be having mixed sympathomimetic action. First, let's do the direct sympathomimetics. So they act directly as the agonist on the alpha and beta adrenoreceptors, and the transmitters are NA, adrenaline, noradrenaline, isoprenaline, phenylephrine, methoxamine, xylometazoline, salbutamol, right? And here I want to tell you, xylometazoline is used as nasal decongestant. Salbutamol is used as bronchodilator. Indirectly sympathomimetics, they act on adrenergic neuron to release Na, and they increase Na indirectly. And the example is tyramine and amphetamine, like I am telling you since we have started the session. टायरामीन बाहर से अंदर आएगा, Na को बाहर निकालेगा, Na का अमाउंट बाहर बहुत ज़्यादा बढ़ जाएगा और दस अपना वो काम करेगा. This condition is also called as cheese reaction, right? Then mixed action sympathomimetics. They act directly as well as indirectly, and the drugs are dopamine, mephentermine, and ephedrine. Ephedrine, mephentermine, and dopamine, right? Now let's discuss the actions of alpha and beta, right? So alpha, it constricts the arterioles and veins, and thus it causes the rise in BP, both alpha 1 and alpha 2, right? On heart, there is a little action, and arrhythmia can be there and take place at higher doses of alpha agonist drugs, right? Then it is alpha receptors are not present on bronchus, so as such there will be no bronchodilation or constriction or any action. They also causes the contraction of the radial muscles of the iris, which causes the mydriasis, right? And thus decreased aqueous secretion. It causes the intestinal relaxation and contraction of sphincters. ब्लैडर ट्राइगोन को कॉन्ट्रैक्ट करते हैं, जिसकी वजह से इट कैन कॉज यूरिनरी रिटेंशन एज वेल, राइट? दैट्स व्हाई वी गिव prazosin, that is a alpha antagonist or a alpha blocker. Then uterus per it causes contraction because alpha 1 receptors are present on uterus as well. Then splenic capsule per B, alpha 1 receptors are present and it will be causing the contraction of splenic capsule. Neuromuscular transmission is facilitated and they will increase ACH release. Insulin secretion is inhibited and liver में glycogenolysis is there. Right, glycogenolysis का मतलब ultimately blood sugar will be increased. Male sex organ में ejaculation will be there. Salivary gland में K plus and water secretion will be enhanced. Then nictitating membrane in animals, it will be contracting the nictitating membranes that is present in animals. Right. Then beta actions. Dilatation of arterioles and veins. Beta action की वजह से there is dilatation of the arterioles and veins and there will be fall in BP due to beta 2, right? Then this causes cardiac stimulation. Beta 1 causes cardiac stimulation. It will be increasing the rate of the heart. It will be increasing the force of conduction and it will be dilating the bronchus. That's why beta 2 agonists are the preferred drug for the acute asthmatic attack. Then beta receptors are not present on iris and there will be slight relaxation of the ciliary muscles and enhanced aqueous secretions, intestinal relaxation and detrusor relaxation, then relaxation of uterus as well. So जहाँ जहाँ पर वो contract करा था, it is relaxing. Splenic capsule is also relaxed here. Then active state में prolonged in fast contracting muscle, abbreviated in slow contracting muscle, thus it can produce tremors. And if we will be giving beta blockers, then जो tremors हैं वो भी ठीक हो जाते हैं. Essential tremors जो हैं वो भी around treat हो जाते हैं. Then augmented insulin and glucagon secretion, right? Then liver में glycogenolysis cause करेगा, hyperglycemia करेगा, ultimately it will increase the blood glucose level. Muscle में glycogenolysis करेगा, hyperlactic acidemia करेगा. Fat में it will be causing lipolysis and increase blood FFAs and calorigenesis. And it will be increasing the renin release from the kidney, जिसके काफ़ी सारे side effects, remodeling effects, mortality वाले effects, बहुत सारे effects हैं. And वो सब हमने the drugs affecting RAS में करा. That is the first topic of CVS. Then beta will be increasing the tyline secretion as well. And ADH secretion from posterior pituitary, right? एंड अब ये तीन चीज़ें बहुत ही ज़्यादा जाननी ज़रूरी है बिफोर हेडिंग टुवर्ड्स द एक्शंस ऑफ द सिंपैथेटिक स्टिमुलेशन. और सिंपैथेटिक एक्शंस को समझने से पहले यू मस्ट बी रिमेंबरिंग दीज थ्री थिंग्स. फर्स्ट इज एड्रेनलिन स्टिमुलेट्स alpha 1, alpha 2, beta 1, beta 2 and beta 3. Almost all receptors, right? नीचे आए एक रिसेप्टर खत्म हो गया, right? Now noradrenaline will be stimulating alpha 1, alpha 2 and beta 1. एंड अगर आपको मार्क्स लाने हैं यूनिवर्सिटी एग्जाम में देन बीटा 3 भी लिख देना, बीटा 2 हट जाएगा, राइट? एंड आइसोप्रेनालिन, लाइक मैंने पहले बता चुका हूं, आइसोप्रेनालिन is having only on beta actions, or it will be stimulating only beta receptors. It will be stimulating beta 1, beta 2 and beta 3, but no action on alpha. Adrenaline is having its stimulation on all of the receptors. Noradrenaline will be having on alpha 1, alpha 2, beta 1, beta 3. No beta 2 action will be produced. Isoprenaline will be only having beta stimulation, no alpha. Right? Is it fine? Let's move further. I hope I am making myself clear and आप सबको समझ में आ रहा है. So आगे बढ़ते हैं. Now we will be discussing the actions. But उससे पहले मेरा फ़ोन जो है वो डिस्चार्ज हो चुका है. So 1 सेकेंड के अंदर मैं चार्जर ला रहा हूँ एंड आई एम सॉरी फॉर दैट कि मेरे को उठ के जाना पड़ रहा है. बट क्या चार्जर लाना ज़रूरी है, आपकी लाइव चैट भी पढ़ना ज़रूरी है. Oh, yeah, now अब ये चार्ज तो होने लग ही जाएगा. हाँ, so now we will be discussing about the actions. फर्स्ट हार्ट पे डिस्कस करते हैं. एड्रेनलिन increases the heart rate by increasing the slope of the slow diastolic depolarization of the cells in the SA node, and it also activates the latent pacemakers in AV node and Purkinje fibers. Arrhythmia can occur with high doses that raise the BP markedly. Right? Raised BP reflexly depresses the SA node and unmasks the latent pacemakers. Certain anesthetics, chloroform, halothane, sensitize the heart to arrhythmic action of adrenaline. And the idioventricular rate is increased in the patients with complete heart block. And the force of cardiac contraction is increased. And the development of tension as well as the relaxation are accelerated. Thus, systole is shortened more than diastole. Right. So the cardiac output and oxygen consumption of the heart are markedly enhanced. And the conduction velocity through AV node bundle of his atrial and ventricular fibers are increased. Then partial AV block may be overcome and the refractory period of all the type of cardiac cells is reduced. And all cardiac actions are predominantly beta 1 receptor mediated. Right. So beta 1 is there. So heart is only having the innervation of the beta 1 receptor. Right. Let me just open the live chat again. Sorry. Yeah, now it's fine now. So, yeah. So, when BP rises markedly, reflex bradycardia occurs due to the stimulation of the vagus. This is usual response seen when NA is injected IV. So, guys, heart per it will be increasing the BP, heart rate, and it will be causing tachycardia and all of that. Right. So, adrenaline increases the heart rate by increasing the slope of the slow diastolic depolarization of the cells in the SA node. And it also activates the latent pacemakers in the AV node, Purkinje fiber. So, thus it can cause arrhythmia, but only at higher doses. Right. And the raised BP reflexly depresses the SA node and unmasks the latent pacemaker. So this is another reason of causing arrhythmia. right? Certain anesthetics like chloroform, halothane sensitize the heart to arrhythmic action of adrenaline, and idioventricular rate is increased in the patients with complete heart block, and force of contraction is increased, development of the tension as well as relaxation are accelerated, thus systole is shortened more than diastole, and cardiac output and oxygen consumption of the heart are markedly enhanced. The conduction velocity through AV node bundle of his atrial and ventricular fibers is increased. Then partial AV block may be overcome. Refractory period of all types of cardiac cells is reduced, and all the cardiac actions are predominantly beta 1 receptor mediated. And so beta 1 की stimulation will be causing all these actions, right? And when BP rises, there will be reflex bradycardia by the reflex stimulation of the vagus. So this is the usual response seen when Na is injected IV. Then blood vessels. अभी तक हमारा इंपॉर्टेंट टॉपिक एज सच नहीं है. इंपॉर्टेंट हमारा आएगा बीपी में. बीपी पे कैसा इफेक्ट आता है वो हमारे लिए जानना बहुत ही ज्यादा जरूरी है, राइट? So both vasoconstriction and vasodilation can occur, like I have told you. Alpha 1 causes vasoconstriction, beta 2 causes vasodilation. Alpha 1 receptors are strong, beta 2 receptors are sensitive. ये मैं अगली स्लाइड में बताऊंगा. So can both vasoconstriction and vasodilation can occur depending upon the drug, its dose and vascular bed. Constriction predominates in the cutaneous, mucosal membrane and renal beds. The vasoconstriction occurs through both alpha 1 and alpha 2 receptors. However, location of alpha 2 is extrajunctional. Alpha 2 receptor is such that they are activated only by the circulating CAs, whereas alpha 1 receptor primarily mediates the response to the neuronally released Na. And dilatation predominates in the skeletal muscle, liver, coronaries, and the direct effect on the cerebral vessel is not prominent. And the blood flow through these bed parallels, and blood flow through this bed parallel change in the BP, right? So dilate होगी तो BP लो हो जाएगा. कंस्ट्रिक्ट होगी तो बीपी बढ़ जाएगा, राइट? द एक्शन इज मोर मार्क्ड ऑन द आर्टीरियोल्स, प्री कैपिलरी स्फिंक्टर्स, लार्ज आर्टरीज, veins are affected at higher doses, right? Now comes the most important thing, the most important slide of the whole session comes now. So let's start. First of all, before starting मैं ये बता दूं, alpha 1 मैं कह रहा हूं it causes vasoconstriction and it is a strong receptor. Beta 1 मैं कह रहा हूं vasodilation करेगा and it is a sensitive receptor. Strong से मेरा मतलब है for activation of alpha 1 you need high amount of adrenaline, right? For the activation of alpha 1 you need high amounts of adrenaline, right? This is beta 2, and beta 2 can be activated even at lower doses, right? अल्फा 1 के जो स्ट्रॉन्ग रिसेप्टर है वो स्ट्रॉन्ग है, बाहुबली है, वो अपने आगे बीटा 2 को देखने ही नहीं देंगे, इफेक्ट प्रोड्यूस करने ही नहीं देंगे. अल्फा 1 का जो इफेक्ट है दैट विल बी मास्किंग द बीटा 2 एक्शंस, राइट? If beta 2 is activated, now if alpha 1 is activated, तो किसी का भी कोई एक्शन प्रोड्यूस नहीं होगा, सिर्फ अल्फा 1 अपना एक्शन प्रोड्यूस करेगा, दैट इज वेसोकंस्ट्रिक्शन एंड बीपी बढ़ा देगा, राइट। बट आपने आईवी बोलस दे दिया एड्रेनलिन, आपने एक पेशेंट को आईवी बोलस एड्रेनलिन दिया, इनिशियली he will be having rise in BP because of the vasoconstrictory action, but एड्रेनलिन मेटाबोलाइज होगा, एक्सक्रीट होगा एंड धीरे धीरे बॉडी से खत्म होगा. सो नाउ alpha 1 will not be getting the high doses of adrenaline. Now what will happen? Now the small doses of adrenaline will be activating the beta 2, right? This beta 2 will be causing vasodilation. Thus it will cause decrease in BP. So एक बार अच्छे से करते हैं, फिर लास्ट में डिस्कस करेंगे, राइट. BP, the effect depends on the amine, its dose and the rate of administration. So Na की बात करते हैं पहले. Na causes, सबसे पहले Na का कहाँ इफेक्ट है, Na का कहाँ इफेक्ट है, अगर याद नहीं है तो दोबारा चल लेते हैं. Na can only stimulate alpha 1, alpha 2, beta 1 and beta 3. No beta 2, no vasodilation, right? Now Na causes rise in systolic and diastolic and the mean BP, because it will be only activating the alpha 1 receptor, only alpha 1 receptor. It cannot stimulate beta 2 receptor, so सिर्फ BP बढ़ाएगा. It will cause rise in BP, right? Because it is only stimulating alpha 1 receptor. Now comes isoprenaline. आइसोप्रेनालिन मैंने आपको याद कराया था कि ये सिर्फ बीटा रिसेप्टर को ही एक्टिवेट करता है, नो अल्फा स्टिमुलेशन. नाउ व्हाट विल हैपन? Isoprenaline will only be activating, will only be showing its action through beta 2 stimulation, right? So it will be causing fall in BP. Now comes adrenaline, that can stimulate alpha 1, alpha 2, beta 1, beta 2 and beta 3, all the receptors. Now if you give slow IV infusion or SC injection, so it will cause initial rise in systolic BP and fall in diastolic BP, because peripheral resistance decreases, because beta 2 receptors are more sensitive than alpha receptors, right? This is the cause, जैसे मैंने आपको बता दिया. Mean BP generally rises because systolic is rising and diastolic is falling. Pulse pressure is increased. अब बात करते हैं, रैपिड आईवी इंजेक्शन दे दिया आपने एड्रेनलिन का. नाउ व्हाट विल हैपन? रैपिड दिया है, रैपिड इंजेक्शन की वजह से ऑल द अल्फा 1 रिसेप्टर्स विल बी स्टिमुलेटेड. Both systolic and diastolic BP will rise and there will be marked rise in BP because it is stimulating the Bahubali receptors, right? But असली कहानी तो अब शुरू होती है. After few minutes there will be a secondary fall in BP because amount of adrenaline will decrease and thus now no alpha 1 will be stimulated. Only beta 2 receptor will get its stimulation because एड्रेनलिन की अमाउंट हमारी बॉडी में बहुत ज्यादा कम हो चुकी है, राइट. The BP returns to the normal within a few minutes and a secondary fall is seen, and this is because only beta 2 receptors are stimulated. इसका ग्राफ बना के समझाता हूं मैं आपको. दिस इज द मोस्ट इंपॉर्टेंट थिंग. इनिशियल राइज हुआ, फॉल हुआ, क्वांटिटी कम हुई. सो ये जो राइज हो रहा है दैट इज बिकॉज ऑफ अल्फा 1. बट अब अल्फा 1 स्टिमुलेट नहीं हो सकते, तो बीटा 2 की वजह से देयर इज मार्क्ड फॉल इन बीपी, राइट. अब आगे चलते हैं, राइट. सो द बीपी रिटर्न्स टू द नॉर्मल विद इन द फ्यू मिनट्स, और ये हमने बात कर ली. दिस मैकेनिज्म इज रैपिड अपटेक एंड डिसिपेशन ऑफ द एड्रेनलिन. The concentration around the receptor is reduced and the low concentration is not able to act on the alpha but continue to act on the beta, and thus अगर आप अल्फा ब्लॉकर देते हो इस पेशेंट को, देखो अब समझने की बात है. नॉर्मल ये आ रहा है, राइट. इफ यू आर गिविंग अल्फा ब्लॉकर टू दिस पेशेंट देन व्हाट विल हैपन. अब क्या है, अब इस पेशेंट ने पहले से अल्फा ब्लॉकर ले रखी है और ये आपके पास आया, आपको इसने हिस्ट्री नहीं दी और आपने पूछी भी नहीं कि कौन सी दवाइयां लेते हो, आपने नहीं पूछा. इंटर्न हो, नए नए गए हो, तो अब क्या होगा, अब आप एड्रेनलिन चढ़ाओगे. पेशेंट हाइपोटेंशन में है, मान लो अल्फा ब्लॉकर भी ले रखा है, राइट. आपको उसकी हाइपोटेंशन क्लियर करनी है, बीपी बढ़ाना है. यू हैव टू इंक्रीज द बीपी, बट यू हैव नॉट आस्क्ड द हिस्ट्री ऑफ द पेशेंट. यू हैव नॉट आस्क्ड द ड्रग हिस्ट्री ऑफ द पेशेंट. ही हैज टेकन अल्फा ब्लॉकर. नाउ you will be administering adrenaline, right. आपने एड्रेनलिन दे दिया. आइडली ग्राफ कैसा आना चाहिए था, आपको क्या लग रहा था, पहले राइज होगा और फॉल होने से पहले मैं देख लूंगा, राइट. राइज कर दूं एक बार, राइट, है ना, आपने ये सोचा. तो अल्फा 1 की वजह से राइज होगा, बीटा 2 की वजह से फॉल होगा. बट आपको ये तो पता ही नहीं कि अल्फा ब्लॉकर ले रखी है पेशेंट ने. नाउ व्हाट विल हैपन. पेन की इंक चेंज कर लेता हूं मैं, फिर बताता हूं. अल्फा ब्लॉकर की वजह से अल्फा स्टिमुलेशन नहीं हो पाएगा, एंड नाउ द पेशेंट विल बी गोइंग इनटू हाइपोटेंसिव क्राइसिस. सीवियर हाइपोटेंशन होगा. बिकॉज देखो पहले क्या हो रहा था, सारा का सारा एड्रेनलिन इज यूज्ड अप बाय अल्फा 1, राइट. तो जब बीटा 2 के पास आता था तो बहुत कम एड्रेनलिन बचता था, तो बीटा 2 इतना ज्यादा स्टिमुलेट नहीं हो पाता था. जितना होता था बीपी फॉल कर देता था और खत्म हो जाती थी कहानी. बट नाउ यूज ही नहीं हुआ अल्फा 1 से, तो अल्फा 1 रिसेप्टर्स आर ऑलरेडी ब्लॉक्ड. नाउ व्हाट विल हैपन, नाउ पेशेंट विल बी गोइंग इनटू हाइपोटेंसिव क्राइसिस, and this is called as vasomotor reversal of day. If you have taken alpha blocker, then never ever give adrenaline to that patient. Otherwise there would be hypotensive crisis और आपको पता भी नहीं चलेगा, right. अब वेजोमोटर री रिवर्सल की बात करते हैं. वेजोमोटर रिवर्सल के अंदर तो द पेशेंट हैज टेकन अल्फा ब्लॉकर, राइट. नाउ री रिवर्सल के अंदर पेशेंट इज विद बीटा ब्लॉकर. अब बात करते हैं बीटा ब्लॉकर री रिवर्सल की, राइट. इसको एक बार इरेज करते हैं. वेजोमोटर reversal of day, right? नाउ नॉर्मल सिनेरियो मैंने आपको समझा दिया कि क्या होता है नॉर्मल सिनेरियो. एड्रेनलिन पहले अल्फा 1 को स्टिमुलेट करेगा, बीपी राइज होगा, देन बीटा 2 को करेगा, बीपी फॉल होगा, राइट राइट. बट नाउ द पेशेंट हैज टेकन बीटा 2 बीटा 2 blockers or beta blockers, right? The patient has taken beta blockers. Now what will happen? Only and only alpha 1 will get stimulation. एंड इतना राइज स्टिमुलेशन होगा कि मेरे कंप्यूटर की स्क्रीन, मेरे लैपटॉप की स्क्रीन से भी एकदम ऊपर फाड़ के निकलेगा और फॉल नहीं दिखेगा. नो फॉल इज सीन हियर, राइट? बिकॉज बीटा ब्लॉकर्स ले रखे हैं, बीटा रिसेप्टर्स आर ऑलरेडी ब्लॉक्ड, तो सिर्फ मार्क्ड राइज इन बीपी ही दिखेगा, राइट? अब एक बार मैं दोनों डायग्राम साथ में बना देता हूं, अच्छे से समझ लो और उसके बाद आगे बढ़ेंगे. This is vasomotor reversal of Dale. This is vasomotor re-reversal of Dale, right? This is the normal graph. Alpha 1, beta 2, alpha 1, beta 2, right? Vasomotor reversal of Dale के अंदर patient has taken alpha blocker, so there would be marked fall in BP, right? This is the graph for vasomotor reversal of Dale. And ये थोड़ा अलग कलर से बना लेते हैं. क्या कलर चूज करूँ? येलो. Oh, it will not be visible. It is looking same. No, it is fine. री-रिवर्सल के अंदर पेशेंट हैज टेकन बीटा ब्लॉकर. कैसे दिखेगा ग्राफ? राइज इन बीपी, राइट? दिस वॉज द वेजोमोटर रिवर्सल ऑफ Dale, राइट? आई होप I made myself clear. अगर कुछ डाउट हो तो चैट में पूछ लो. एक बार दोबारा से देख लेते हैं फटाफट से क्या क्या पढ़ा हमने. एड्रेनर्जिक रिसेप्टर्स, एड्रेनर्जिक ड्रग्स हमने स्टार्ट करी थी. सो एड्रेनर्जिक ड्रग्स हैं जो कि सिंपैथेटिक एक्टिवेशन करती हैं. That will be stimulating the heart, that will be causing the rise in BP, tachycardia, that will be dilating the bronchus, that will be decreasing the tone of GI muscles and all of that. हमने actions discuss कर लिए. So adrenergic transmission is due to the catecholamines, and there are 3 types of catecholamines: noradrenaline, adrenaline and dopamine. So main किससे start होता है? फिनाइल एलेनाइन से कहानी स्टार्ट होती है. फिनाइल एलेनाइन इज गेट्स कन्वर्टेड टू द टायरोसिन, टायरोसिन विल बी कन्वर्टेड टू द डोपा, डोपामिन, डोपा विल बी converting to the dopamine. Dopamine will come inside the vesicle and dopamine noradrenaline में कन्वर्ट होगा, एड्रेनालिन में कन्वर्ट होगा सिर्फ एड्रीनल मेड्यूला में. नहीं तो ये स्टेप यहीं स्टॉप हो जाएगा, पूरी बॉडी में ये स्टेप यहीं स्टॉप हो जाएगा. एंड एड्रीनल मेड्यूला में इट विल बी कन्वर्टेड टू एड्रेनालिन, राइट? Storage of CA. Na is stored in synaptic vesicular granules with the adrenergic nerve terminal. The vesicular membrane actively takes up the dopamine from the cytoplasm and final step of the synthesis of the Na. So yeah, this we have already discussed, and let's see live chat. Clear. Oh, so thank you. You all have understood, right? So let's move further. या एक सेकेंड हाँ, देन रिलीज की हमने बात कर ली थी. अपटेक 3 टाइप्स का होता है, वो बात कर ली थी हमने, समझ लिया था अच्छे से क्या कैसे हो रहा है. हमने एक्शंस देख लिए थे, हमने रिसेप्टर्स के बारे में बात कर ली, हमने अच्छे से एक्शंस दोबारा देख लिए, हमने फिर स्टिमुलेट क्या क्या किस किस को करता है वो देख लिया, फिर हमने हार्ट के एक्शंस, ब्लड वेसल, बीपी देख लिया. नाउ रेस्पिरेशन पे आते हैं. एड्रेनलिन, आइसोप्रेनालिन बट नॉट एन आर पोटेंट ब्रोंकोडाइलेटर्स. एन इसलिए नहीं करता बिकॉज एन बीटा 2 को स्टिमुलेट नहीं कर सकता, एंड ब्रोंकस पर एज लंग्स 2 हैं तो सिर्फ बीटा 2 रिसेप्टर्स होते हैं, और वी वांट अ B2 stimulation action, agonistic action, right? So this action is more marked when the bronchi are constricted, and adrenaline given by aerosols additionally decongest bronchial mucosa by alpha action. Adrenaline can directly stimulate the respiratory center, but this action is seldom manifest at clinically used doses. Rapid IV injection causes transient apnea due to the reflex inhibition of respiratory RC, right? Toxic doses of adrenaline causes pulmonary edema by shifting blood from the systemic to the pulmonary circuit, right? So what is he saying, that rapid IV injection दो ना तो there is transient apnea due to the reflux inhibition of the respiratory center, and toxic doses of adrenaline cause pulmonary edema by shifting of the blood from systemic to pulmonary circuit. Then IA में it causes mydriasis. Mydriasis occurs due to the contraction of the radial muscles of the iris alba 1, and but this is minimal after the topical application because adrenaline penetrates the cornea properly, and wait a second, the intraocular tension tends to fall, especially the wide angle glaucoma. And GIT में in isolated preparations for GIT, relaxation occurs through activation of the alpha beta receptor. And bladder के अंदर detrusor is relaxed, trigon is constricted due to alpha. So the patient that is having benign prostatic hypertrophy, we will be giving alpha blocker or prazosin, tamsulosin or silodosin like drugs. Uterus पे adrenaline can both contract and relax the uterine muscles respectively through alpha and beta receptors. The overall effect varies with species, hormonal and gestational status. Human uterus is relaxed by adrenaline at term of pregnancy, but at other times its concentrations are enhanced, right? And splenic capsule contracts due to alpha receptor, and more RBCs are poured in circulation, and this is not evident in man. This is theoretical, this is not practical. And skeletal muscle की बात करूँ, then neuromuscular transmission is facilitated, and in contrast to action of the autonomic nerve endings, alpha receptor activation on the motor nerve endings augment the ACH release, and probably because of its alpha 1 subtype, the direct effect on the muscle fiber is exerted through the beta 2 receptors and differs according to the type of fiber, and the active state is abbreviated and less tension is developed in the slow contracting red fibers. There is incomplete fusion of the individual responses. This, along with enhanced firing of the muscle spindles, is responsible for the tremors that are produced by beta 2 agonists. The actions on the rapidly contracting white fiber is to prolong the active state and increase the tension developed. Then CNS per adrenaline in clinically used doses do not produce any CNS effects because of its poor penetration in the brain, but restlessness, apprehension and tremor may occur. Then activation of the alpha 2 receptor in the brain stem results in the decreased sympathetic outflow, and fall in BP is there and bradycardia is there. Metabolic adrenaline causes glycogenolysis, and thus it increases the blood glucose level or hyperglycemia. Hyperlactic acidemia due to beta 2 lipolysis, and lipolysis की वजह से डिसलिपिडीमिया होता है, देयर आर इंक्रीज फ्री फैटी एसिड्स एंड टीजीज इन द सीरम। देन दीज आर, किसके मैसेज आ रहे हैं यार? सर कैन वी गेट द लेक्चर नोट्स? यस, वेरी गुड क्वेश्चन, मैं ये बताने वाला था. सो इफ यू वांट the PDF notes of each and every lecture or session or online class, then अगर आप फोन से देख रहे हो वीडियो तो आप इसके बिल्कुल कोने में जाओ, अबाउट पर नीचे लिंक मिलेगा PDF नोट्स, वो आप खोलोगे तो खुल जाएगा. और शायद अब इन्होंने इम्प्रूव कर लिया होगा, मैं एक बार चेक कर लेता हूँ. लास्ट टाइम नहीं खुल रहा था तो आप लोगों ने कहा कि आप तो ऐसे ही कह रहे हो, लेकिन खुल जाता है यार, मेरे से तो खुल जाता है. लेट्स सी, मैं खोल के देखता हूँ फिर आपको बताता हूँ. वेट, खुल जा. Everything is good, net is also good, but still what's wrong with this? Yeah, now it is opening guys. दिखाऊं मैं आपको? एक सेकेंड, मैं आपको पास ला के दिखाता हूँ, एक बार आप भी खोल के देख लेना. सो दिस इज द थिंग. एक सेकेंड, ब्राइटनेस बढ़ा दूंगा, ब्राइटनेस बिल्कुल कम है. हाँ, ये देखो गाइज, मेरे से तो खुल गया. एक बार आप खोल के मेरे को अभी अभी बताओ कि खुल रहा है या नहीं, तो फिर देखते हैं आगे. ठीक है, देखो यहाँ पर तो देखो लिखा हुआ आ रहा है ऐसे शिव विरमानी, नीचे क्लास के टाइटल्स, और मैं यहाँ पर लगभग ना सारे जितने भी मैंने सेशंस लिया ना लास्ट मंथ की भी, सो आई विल ट्राई टू अपलोड दैट PDF नोट्स, बट यार टाइम नहीं मिलता. प्रॉब्लम इज दैट भूल जाता हूँ मैं. सो राइट, अब एक बार चैट में चल के देख लेते हैं. हाँ, ओनली CNS इज देयर, मतलब इस मंथ की क्लास का ही नोट दिख रहे हैं अभी. हाँ, दैट्स व्हाट आई एम सेइंग मैन. आई विल बी अपलोडिंग अदर नोट्स, बट अगर आपको GIT वगैरह के लेने हैं, ब्लड के लेने हैं, तो ऐप पर तो अवेलेबल होते हैं. तो ऐप पर आप जाओ, एंड ऐप पर जाओगे तो आपको वहाँ GIT के मिल जाएंगे, ब्लड के मिल जाएंगे, और 2-4 और के मिल जाने चाहिए. और बाकी मैं अपलोड कर दूँगा CVS का भी, एंटीबायोटिक्स का भी. राइट, आई विल अपलोड. एक्चुअली बहुत ही ज़्यादा ना हेक्टिक सा शेड्यूल चल रहा है. आई विल ट्राई. शायद इस संडे तक अपलोड कर दूँ मैं. इस संडे तक आई विल ट्राई टू अपलोड द थिंग्स. राइट, मोस्ट प्रोबेबली दिस संडे. Yes, this Sunday. Please upload on the Telegram group. Telegram group पर upload. Yeah, I will upload. कहीं ना कहीं तो अपलोड कर ही दूंगा मैं भी क्या करूं यार, कई बार ऐसा शेड्यूल हेक्टिक सा हो जाता है. चलो, we'll see. So there is transient hyperkalemia followed by hypokalemia that occurs due to the initial rise in K+ from the liver, and later is enhanced uptake into the skeletal muscle as well as in the liver. So I think that we should end this session here. हाँ, ये लास्ट स्लाइड है. हाँ, तो एक बार एडवर्स इफेक्ट्स पढ़ लेते हैं, then we will be ending this session here. So adverse effects and contraindications, these are really important. So when you are given adrenomimetic drugs, just sympathomimetic drugs, then the patient will be feeling or can have transient restlessness, headache, palpitation, anxiety, tremor, pallor, and may occur after SCIM injection of the adrenaline, right? There can be marked rise in BP leading to cerebral hemorrhage, ventricular tachycardia, fibrillation, angina, MI, and all other hazards. Right. Then adrenaline is contraindicated in hypertensive, hyperthyroid, and angina patients. Right. But adrenaline is the drug of choice in the septic shock. Then adrenaline should not be given during anesthesia with halothane because there is high chances of arrhythmia, and to the patients receiving the beta blockers there can be marked rise in BP and due to the unopposed alpha action, right? So with this, let's end this session. टेलीग्राम ग्रुप बन गया है, टेलीग्राम ग्रुप. आई एम रियली सॉरी, मैं टेलीग्राम ग्रुप के बारे में थोड़ा भूल सा गया था. will create it by this Sunday, hopefully. Hope for the best, guys. I will be uploading the notes by this Sunday. और अगर नहीं हो तो आप मुझे संडे के बाद एक बार फिर से रिमाइंड करवा देना. एंड अभी तक मैंने नहीं करे, आई एम रियली सॉरी, बट या थोड़ा सा ना ऐसा ही चल जाता है ना थोड़ा. सो दैट वाज ऑल फॉर टुडे. थैंक you so much, guys. Thank you so much for being here. Thank you so much for coming here. Thank you so much for listening to me, listening to my bakwas. Thank you so much for understanding the things, for accepting my theory, my concepts, my notes, and thank you very much. And I will be meeting you soon. यहाँ नहीं तो कहीं और नहीं तो यहाँ कहीं ना कहीं तो मिलूंगा ज़रूर. And with this, let's end this session. Bye, guys. Take care. Stay healthy, stay positive, and stay focused. And keep fighting for your goals. Bye, guys. Take care. And good night.